The best advice I would give any doctor starting out in skin cancer in general practice is education. You need to know what you're looking at. At the end of the day, if you can identify a lesion as suspicious or not, you've got no chance. So I would say probably the best advice I can give any doctor starting out in skin cancer is education. The first step after doing one of the initial courses is to start looking at as many lesions as possible. Own a dermatoscope and put it on as many lesions as possible and apply the dermoscopic techniques we teach you. And then the second obviously would be to start creating structured sessions for seeing skin checks and for doing procedures. But skin cancer is a numbers game. The more you do, the better you get. So when you do get your dermatoscope, look at everything. Obviously starting out with the basics is the most important thing. You don't need to be able to do complex flaps and complex grafts and be able to name what a lesion is. To start off with, you've simply got to be able to work out whether it's suspicious or not and be able to surgically remove it from a patient so you can get a diagnosis. I would focus for as long as you can on that process, getting as many ellipses done and getting the speed up. It is a speed game, being able to do a simple ellipse in 15 minutes is the trick to it. Once you can confidently do an ellipse in 15 minutes, you're then ready to tackle the more complicated procedures. Any doctor who doesn't want to get into skin cancer, find another GP you can refer work to. Some people just aren't interested in skin cancer. There is no risk of messing it up. There's probably a bigger risk of a patient coming in with a blatant, obvious skin cancer on their face and you not even noticing it and never even picking it up. I think every GP in Australia needs to be able to identify a suspicious lesion. They don't need to be able to treat it. They need to be able to identify it and at least have the capacity to refer it.